Welcome to the deep dive. Today we're getting to something huge, generative AI. Things like large language models, and specifically how they're making waves in a really critical area, healthcare.
That's right. And we're focusing on health technology assessment, or HTA. It's all about how we evaluate new health tech. This deep dive is basically your shortcut, drawing from a key report.
Yeah, this is based on the ISPOR Working Group's paper on generative AI for HTA. It covers the opportunities, the challenges, the policy side of things.
Exactly. Titled Generative Artificial Intelligence for Health Technology Assessment, Opportunities, Challenges, and Policy Considerations.
So our mission today, we want to unpack the immense potential these tools have for HTA, but just as importantly, flag the limitations, the risks, the stuff you really need to be aware of. What are the big aha moments here?
And the urgent questions, definitely. So first off, generative AI, what is it? Simply put, these are AI systems that create new stuff, text, images, code based on massive amounts of data they've learned from.
And LLMs, large language models, are a big part of that, like foundation models, these big pre-trained AIs that can then be adapted for lots of different tasks.
Precisely. So where does the report see the big opportunities in HTA? Well, it points to three key areas where generative AI could really automate and enhance things.
Okay, let's break those down. What's the first one?
Systematic literature reviews. This is a huge part of HTA. Imagine AI helping draft search terms, maybe screen abstracts, or even pull out data.
Pull out data. How accurate are we talking?
Well, some studies mention, like with GPT-4, show potential for really high accuracy, think 99% in certain data extraction tasks. It might even help generate code for meta-analyses.
Wow, generate code. That's not just faster. That changes how things are done, frees people up for the harder thinking, right? The qualitative stuff.
Exactly. It takes away some of the grunt work, you could say. The second area is real-world evidence, or RWE.
Dealing with all that messy real-world data.
Yeah, AI could streamline processing huge amounts of it. And interestingly, it could help pull info from unstructured clinical notes, stuff that's usually really hard to analyze systematically.
Okay, so processing literature, processing real-world data. What about the modeling side? Health economic modeling is pretty core to HTA.
Right. The report suggests AI could help there too. From just conceptualizing a model to finding the right parameters, even helping with validation, it could automate some really resource-heavy steps.
Making model development maybe faster, more efficient.
Potentially, yes. But, and this is crucial, the report stresses that right now these tools are meant to augment human work, not replace it. Humans are still fully responsible for the outputs.
That's a really important point. Augment, not replace. But it does bring up challenges, doesn't it? The limitations, the risks. We hear about AI hallucinations, right?
Absolutely, where the AI just makes things up. Incorrect facts, sometimes presented very confidently. The report even mentions fabricated citations as a risk.
Which is worrying. And what about reproducibility? If these LLMs are kind of black boxes, how do we verify how they got an answer?
That's a major scientific validity concern. We see the input, we see the output, but the why in the middle can be opaque. And then there's bias.
Yes. Bias in the training data leading to biased results.
Exactly. If the historical data underrepresent certain groups, the AI might learn and even amplify those biases. That has huge implications for equity and fairness, potentially giving inaccurate results for some populations.
And the report mentions some pretty surprising ethical issues, too, like AI identifying a patient's race from medical images when humans can't.
Yeah, that was a striking finding. It shows AI isn't just reflecting human biases, it might be picking up on correlations we don't even see, which raises really deep questions about fairness and potential misuse. Privacy is another big one, models potentially memorizing and reproducing protected health info.
So how are regulators and HTA agencies handling all this? Feels like a fast-moving target.
It is. The landscape is varied. You have the EU with quite a comprehensive framework for high-risk AI. Then places like the UK, Japan, the US are often taking more flexible, sector-specific approaches.
And the HTA agencies themselves, are they embracing this or being cautious?
Mostly cautious, it seems. Many are still exploring. Some, the report notes, have even blocked tools like ChatGPT internally for now. They're figuring it out.
So what does the report recommend for these agencies?
Key things are Develop clear guidance, try to harmonize standards across different places, really make sure health equity is baked into how they use AI, and definitely invest in training their workforce. People need to understand these tools.
Right, training is key. So wrapping up, generative AI clearly offers some potentially transformative tools for HTA. Huge potential, but it's moving fast and needs really careful ongoing evaluation.
Definitely. The risks, the black box nature, the bias, the hallucinations, they're significant.
Which leaves us with a big question, maybe the big question for you listening. Given these powerful but sometimes opaque AI tools, how do we ensure they actually advance healthcare fairly and transparently for everyone, especially when we can't always see why the AI reached an conclusion? What does that real human-AI partnership look like going forward?
How do we build trust and accountability in a system that's increasingly reliant on technology we don't fully understand? That's something we all need to be thinking about.